State Senator Emmanuel Jones, and I'm going to call our meeting to order. We have been joined by other members of the Firearm Safe Storage Study Committee virtually, and I'm going to allow them to introduce themselves if we're ready.
Good morning, Chairman.
Good morning, Mr. Chairman. How are you?
This is Frank. Said I'm doing very well. Sorry, our scheduling keeps getting way late. I'm in Savannah this morning. I don't know if Dr. Watson's on the line or not, but I'm down here in his district with the Georgia Economic Developers Association this morning. But I said no, I'm going to definitely participate the best I can on the study committee, and looking forward to good information.
And this is Ben Watson. Hey, Mr. Chairman, this is Ben Watson. I'm here in Savannah also. I appreciate you having this and look forward to hearing from everybody.
Thank you, Mr. Chairman. Is anyone else that we have joining us online? We are expecting Senator Lucas to join us. He said he's running a little bit late. He's traveling up from Macon. We have a full agenda.
Senator Harbin here.
Oh, Senator, I didn't see you. Chairman Harbin, please.
Yes, sir. Yes, sir. They didn't invite me to Savannah, so I'm still working, making a living, as you understand, and had conflicts, but glad to be here. Thank you for the work you're doing here as we look at the issues that we're dealing with, and appreciate your involvement, and we'll look forward to all the presentations that are coming forward, and thank you for what you do and for the people that are there.
Thank you, Mr. Chairman. I'm excited to have my colleagues join me, and we are expecting again the final member of our study committee, and that's Senator Lucas, David Lucas from Macon, to join us as well. He is running late, by the way. We have a full agenda, and I hope you all would bear with me today. We're going to try and get through this meeting no more than an hour, maybe an hour and 20 minutes. I understand there's a lot of members of the press is here, and I would certainly encourage anyone that's attending this meeting to freely speak to the press about your feelings in regards to firearm safe storage. And I think that's important because this moment in Georgia's history requires us to speak up and to speak out. I do have a special guest from Vaping Systems that I would like to introduce while I wait for a few of our other members from downstairs to come up and join us. And I'm going to call on the members from Vaping Systems if they would come up and kind of give us a brief demonstration. And if you guys could just kind of tell us about your product and what you all do. And then we're going to roll right into our agenda with Dr. Paige Howard. And we're going to keep going right through our agenda today. So I'm going to give you the floor to Vaping Systems for about 5 minutes so they can explain to everyone here what they do.
Thank you for the time, sir. Thank you, everybody, for being here.
And please introduce yourself.
Martin Dijkema, CEO of Vaping Systems, and John Fitzmeyer, one of our top salesmen at Vaping Systems, ex-law enforcement. And we both have basically, we're at the forefront of school security. That's where our company has gone in the last few years. Just a 30-second background on me. About 30 years ago, I was a mechanical engineering graduate. I worked for a company. We developed high security safes for jewelry stores and things like that. I walked into a safe dealer, actually here in Lawrenceville, Georgia, and all of our high security safes were in one room, safes that you really, are very difficult to break open. He had another room there with a bunch of gun safes. I didn't know what a gun safe was. And I said, what are those safes? And he laughed. He said, they're not really safes. They look like safes, but they're not really safe. So I said, what do you mean? He says, well, people put guns in them, but you can break them open in 5 minutes. Fast forward 25 years, about 5-6 years ago, and I'm aging myself here. I was talking with my business partner on another business, and he's a very knowledgeable person about guns. I was talking with him about gun safes, and I told him I didn't like the fact that gun safes don't offer any real security. We've done a hell of a lot of design for Boeing and big defense contractors, and we started designing, and the end result was this QVR. So the QVR we initially designed, you can't break this open. We designed this for the AR-15 or any long rifle. Why? Because there's 25, 30 million long rifles in private hands today in the US. And people putting them under their beds. They have no way to store them in the master bedroom. Why? Because you can't put a big gun safe in the master bedroom. So we developed it for that. Developed a few prototypes. I dropped off the prototype at the best safe cracker on the planet, a person that specializes in breaking safes open. And when I first said to him, I said, "You're not going to be able to break this gun safe open." And he laughed at me. He said, "Martin, I'll open it in 5 minutes." I left it there for a few weeks. I went back to him. He said, "Martin, it's the first safe I've ever come across that I can't break open." So when we had a few of these recent school shootings, I thought, well, we have the best product in the world that nobody can break open, yet you can access in 2 or 3 seconds. Maybe this is a good product for schools. So fast forward 2, 3 years later, we're in at least 15 school districts in Georgia. Officers love our product. It allows them to safely secure their long rifle in their SRO office. And if there is an active shooter, they can get in the product in 2 or 3 seconds. John, do you want to open this?
So each keypad will secure 15 fingerprints and 3 different numeric codes. So it's biometric to the authorized user only. So it just scans your fingerprints.
So in 2 seconds, he or she can get to his rifle or her rifle. We bolt it to the floor, so no one can walk away with it. No kid will ever break into this. If a safe cracker can't get into this, and that's really the problem. Another problem is some of the school districts like Rowan County, North Carolina. If you look January of this year, 4 students broke into a cheap safe that it took them 40 minutes and they stole the long rifle. It'll never happen with our product. So one of the issues is you can't put bad safes into schools either because you're creating a problem.
We just, please don't interrupt while he's presenting. Thank
So,
you.
and law enforcement has guns in the schools. They've had them in schools for years, and this is a very good way for them to protect those guns. Vapen Systems is the company, and this is the QVR, Vapen Systems, VAPEN Systems. And we have another partner in our business that we work with law enforcement. We work with Daniel Defense. This is Clinton Thornburg from Daniel Defense. And we both, our companies are getting more and more of our products into schools to help law enforcement to secure their weapons and yet to be able to access a weapon if you do have a set.
Will you guys be around afterwards so we can, if anybody has any questions, they can talk to you outside? Yes. Thank you. And I want to thank Chairman Ginn, by the way. Chairman Ginn, I know you're online with us, and I know you have some a relationship with Vapen Systems, and please just kind of tell us why you invited him here today. Chairman Ginn?
Well, thank you, Chairman Jones, for having the folks there today. One of the things that to me was actually reached out to by a constituent just a couple of weeks ago, and said, "Hey, he's providing warehouse space for this company, and he wanted to put me in touch with them, and he knew about our study committee." And I said, "Sure." So went over to Gainesville, and I was quite impressed with the design of the safe and what it would mean for quick access in case of an emergency where law enforcement could be able to get to it, but nobody else could. So that being the case, it was really impressive, and I just wanted to share that with you and some of the other members of the committee and now the public, because they do sell these things to individuals as well as government entities and school systems.
Thank you, Chairman Ginn, and I'm glad that my colleague, who I affectionately call the godfather of the Senate, Senator David Lucas has joined us here today. Senator, you have any opening remarks?
That's Senator Jones, Chairman Jones said before you let the godfather speak, I heard him at one of our previous committee meetings talk about his number of firearms, and just so you know, said while I was at their warehouse, they sell quite a few different size safes, and I think they might have enough to put Senator Lucas's arsenal into.
One of the things that fights any gun legislation is NRA. Most of the so-called mass shootings have come by way of assault rifles. What I think we could do, that's simple, that when a person buys an assault rifle and they don't have a pistol toting permit, which basically when you get the permit says that you legally can carry the gun, that they kind of check you to see whether or not you've been in a mental institution or those kind of things, or whether you've had any run-ins with the law in order to get a pistol toting permit. Many folks don't go get it now because we have a law, you buy a gun, all you gotta do is show an ID. And sometimes felons are able to go and show ID, buy a gun, nothing happens. A felon is not supposed to have a gun, and you don't find out till he actually does something wrong and he has a gun on him, then you find it, he's a felon. So again, I think what we ought to do as a first step is to change the way an assault rifle can be purchased in Georgia. One, either you have a pistol toting permit, which says you legally can buy a gun, you're not a felon, or you have at least a 10-day waiting period from the time of purchase so that you can be checked out for any other things, felons, whether or not you had substance abuse problems, whether you've had mental problems. We had the sheriff from Cobb County, wasn't it?
I need to move on too, by the way.
She made a good statement. We can't put mental problems on this situation. She said some folks are just bad. And she says that the majority of the times, folks are using guns, it's not theirs. They've stolen them out of cars or out of homes. And I kind of tend to agree with her that some folks are just bad. And maybe by putting an extra step when you purchase an assault rifle. Now, a lot of folks are buying them and they're being hired out by farmers on feral hogs because of the rapid fire of the guns and then the night scopes. They can shoot them. But I think the only way that we can probably do something is to put that step in, that in order to purchase an assault rifle, you have to have a pistol toting permit, or you got a 10-day waiting period for that particular person who's purchasing that assault rifle to check them out.
Thank you. And now you all know why we call him the Godfather. Thank you, Senator Lucas. And we will certainly incorporate your remarks into the report from this study committee. Thank you. And I think that's important. Senator Lucas has a lot of experience with big guns and weapons. And I think all of us that serve on this committee, we all bring our own individual expertise, and that's important. So thank you for those remarks. We have some students, and I want to ask the students from Morgan Oliver that are present with us today. I have to recognize them if y'all would kind of bear with us. These kids have come here. I'm going to ask them to come in one door and we'll go out the other. We had a meeting with them downstairs. I know their teachers and professionals are here with them. So I want to ask our students. And I know Miss Aaliyah Strong is on the agenda, and one of the things that she asked me during our meeting was, do you listen to kids, to young people? And I want everyone to know that we do, because their voices is critical to our discussions and critical to our deliberations. And they've been fortunate enough, y'all can come on down, don't be afraid, you can double up. And I'm gonna ask Miss Sanadia, I hope I'm pronouncing her name correctly, Sanadia. Sania, please come up here and join me, by the way, and you can sit right there at that desk, and I'm gonna give you an opportunity just to tell us about why your students are here today.
Yeah.
That's fine, right there.
Thanks so much for having us.
You can speak directly into the microphone.
Thank you for having us. Everybody's been really welcoming. This can be a very scary moment for kids. It's, you know, a lot happening, and we had conversations about the Appalachia shooting. They came in talking about it. They came in with some concerns and fears, and I'd actually love to have one of them share what that process looks like rather than me speak for them.
Absolutely. Out of your time to one of the students, please.
Do y'all want to come and sit? Who would like to share first? I think that whoever wrote the proposal and put it on my desk a couple of Fridays ago, after we had the conversation about what kind of action you wanted to take, should come first.
There's 2 empty seats right there
Y'all can
on both sides of you. But before we get started, though, before they speak, I just want to say that the students were gracious enough to share this poster with me. And before they leave here, I need some signatures on this from them. Will you do that? Will you?
I'm sure they would love to. The school was inspired by my little brother, Morgan. He was a veteran, and he had a lot of struggles with PTSD and depression. And in 2017, he devastatingly ended his life. And he was the other caretaker for my daughter. I was single and going through college, and I wouldn't be here in front of you with a bachelor's and a master's, and the first person in my family to have those pieces of education. And I'm so grateful for him. And so the school was inspired truly by his compassion and grace, kindness and intelligence. And I think that one of the things he cared deeply about was civic engagement and making sure that kids knew that they had a voice, because these are the children that will take over your seats one day.
Absolutely.
And so having them empowered with the school, the tools and the strategies to be
It's
able
okay
to
to clap. We
advocate
don't
for them,
mind that. We need to celebrate these kids.
to be able to advocate for themselves is a critical tool in today's social and global economy. So thanks again for having us, and I'm going to pass it
And
over.
before I do, there is something that I just lead my kids to join in with me on. They were so gracious enough to accommodate me downstairs. So will y'all join me on this? On 3. 1, 2, 3. One more time. Louder so they can hear you.
No, and gun violence. Thank
They
you.
just told us what our committee is about.
And actually, can you go up there? Because
Thank
we
you
have
all.
access to the camera. So yeah, we can come up together. We just want to make sure that everybody can see their face when they share. And if there's anyone else who would like to share, why don't you come on up here?
But I don't have that much time now.
Speak into the mic.
Yeah, stay there, stay over there. Yes, I can turn the mic on for you. Those are our witness seats. Speak directly to that microphone and I'll turn it on for you.
Got this.
And you can pull that microphone towards you. There you go.
Okay. Hello, my name is Autumn Humphreys, and these are things I want to decrease with gun violence. First of all, why can anyone at any time walk into a Walmart and buy an automatic weapon? Because we have no idea what someone can do with that gun. And if they do get a background check, that doesn't mean they're not going to make a crime like after it. we actually need to, we actually found like lots of different information online. So we were very confused about that because like some people said, it's, you don't get a background check, and some websites said you do. And if you do have a gun, it should absolutely be locked away from, children. It is super important to know how to handle a gun and be responsible with it. And please just don't shoot someone because you made the mistake to think someone's sandwich was a gun. And yes, that happened. And I know like some people are like, oops, thought it was a gun. This police officer just caused a whole family pain. Why do guns exist if all we're going to do with them is hurt people for no reason? And all these kids that are shooting at school should not be fully responsible. If these parents know their kid is not mentally well or mad, they need to do something about it. Don't leave these guns accessible because who knows what they will do with it. These parents are just going to say, it's fine, he'll be okay. Really? Then why were 9 people hurt then? And that is why I'm here trying to fix it. Let's talk about the rate of gun violence in Georgia. You know, it's crazy that our gun violence rate is 19.7 out of 100,000. And that's only in Georgia. Georgia doesn't have any foundational gun safety laws. We want this violence number rate to keep getting smaller and smaller. New York's gun violence rate is only 5.3 out of 100,000. We want this to keep getting smaller and smaller. New York's gun violence rate is only 5.3. Okay, we keep asking the adults to do something about this, but they can hear us, but they will not listen. This is our future you're affecting here. We are the next generation, and you're acting like you don't care. Hopefully you can hear our voices now. Thank you for listening.
I can't follow her. That's all I can say. Young lady, thank you for your remarks. Morgan Oliver, thank you all for being here, for being part of this. I think it's important for your advocacy. But I only have one more thing to ask of you. One more time on 3. 1, 2, 3. One more time. This is what our committee is about. Thank you all. Thank you. To our fellow legislators, I just wanted to remind all of us that, you know, the voice of our children are important. So thank you all for indulging me for the kids from Morgan Oliver. Thank you all. Thank you. And I'm keeping my sign too, by the way.
Why, do any Republicans ever show up to any of these things? Ever? Where are they? Where are the Republicans? I can't wait for him to put his hands on me.
Ma'am, let me answer that question for you. We have.
He's answering my question. You will stop.
We have 5 legislators as part of this committee. 3 are Republicans and 2 are Democrats.
Yeah,
And we have full attendance, and you can see them right there on the screen. So thank you for being here.
Of this state, she should not be taken out.
Thank you.
For taking her out. We are parents. I'm going to jail. I'm going to jail. She's going because I'm showing up for your kid. Holding up a sign.
No, she's not going to jail.
So she's being taken out. Are you going to take
Well,
me out next?
Well, it would have been helpful that you all kind of let me know in advance so that I can conduct a meeting and invite you to participate. I'm sorry, I apologize. I didn't know she was coming. Otherwise, I would have put it on the agenda. We do have one more meeting scheduled for the 10th of October, and there's anyone that would like to speak. My admin, Megan Stevens, is present, and all you have to do is reach out to her or reach out to my office, and we're online. So my meetings, I expect to be conducted orderly. And if the chair and the committee deems you have something to say, then yes, we will invite you to speak.
Thank you, Senator.
You're welcome so very much. Our agenda has been published, and we are going to proceed with the agenda. Thank you all for indulging me with the kids again this morning from Morgan Oliver. Our first speaker is Dr. Paige Howell. And I always, while Dr. Howell is coming up, I again have to thank Lauren Pavlo. Lauren, I know you're back there in the back somewhere, but thank you again for working with us. I've invited her to come up here and share the stage with us because she is a critical element, if you will, to us being able to get this information out. And she's been a valuable resource for myself and for other members of the legislature in finding and providing us critical information that we need about child safety laws, about access prevention laws, about mental and health issues as well. And thank you for lending your expertise to us. So if you all would go and introduce yourself, and we will proceed with our first witnesses.
Thank you for allowing us.
If you bring that mic just a little bit closer to you, I want to make sure our colleagues
My name
that's
is-
zooming in can
Thank
hear
you.
you as well.
My name is Paige Howell, not Dr. Paige Howell, just Paige Howell. And
Lauren,
this-
you
pardon?
put this together. She gave you that title. Just kidding, just kidding.
Okay. And this is Jared Turner, and Jared and I are both here on behalf of the Georgia Governor's Challenge. We are the co-leads of the Lethal Means Safety Task Group of the
Okay.
Georgia Governor's Challenge. And we are both passionate about lethal means safety.
Yes, my name is Jared Turner. I'm a Army combat medic, veteran, if you will. So unfortunately, I understand both sides of this. Being from Fort Stewart, Georgia, if you will, part of the initial push, I have a lot of experience on multiple sides of this. So we thank you so much for this opportunity.
Thank you. Jared and I will both be giving the presentation. So you can see my slides, and basically suicide, this is mainly about veterans and suicide.
Okay.
Suicide in the SMVF population. SMVF is service members, veterans, and families. And I am part of the Atlanta VA, and it's part of my role to serve on the Governor's Challenge committee. So it's a public health concern, and the numbers that you're seeing in this initial graph are the unadjusted suicide rate numbers for veterans over the time period starting in 2001 and going through 2021. And the unadjusted suicide rate for veterans was over 33%, almost 34% in 2021. By comparison, for non-veteran U.S. adults, the suicide rate was 16.7 per 100,000 in 2021. So you can see that just by virtue of being a veteran, suicide risk goes up. Oh, it's not going.
Oops. It's not advancing to the next slide.
There we
Thank
go.
you.
Thank you. So lethal means safety is what we're here about. Lethal means safety is a strategy to reduce suicide risk. And basically what it does is it makes a method that could be used for suicide more difficult to access. So it's less likely to result in an actual suicide attempt.
Next, please.
That's not working.
Yeah,
right now.
so
So why is lethal means safety important? It's about time and space. And I'd like for you all to say it with us. Time and space. Time and space. Because it's all about time and space. Thank you. It's about increasing the time and space between someone with suicidal intent and their ability to end their lives by having access to the lethal means that they would use to end their lives with.
And I want to add to what Ms. Howell is saying. As an Army veteran, especially a combat veteran, having multiple weapons, honestly, I never even paid attention to it because I'm that veteran and I represent multiple veterans who we do everything right. But when it comes to suicide and it comes to time and space, we have to address this issue when it comes to Georgia. Seeing how so many veterans and service members are here in Georgia, and as multiple people understand, it's not just when you lose that veteran, it's the family and it's the community that is affected by this. So that's why time and space is it's just so vitally important. And we do, as responsible gun owners, we have to take more to do better to ensure that this has to change.
So let's talk about lethal means safety specifically related to firearms. Just over 72% of all veteran suicides were by firearm in 2021. 72%. In Georgia, however, firearms were used in almost 83% of veteran suicides. So you can see that in Georgia, the veterans are even more likely than the veterans in the country at large to use firearms in a suicide attempt. And for comparison's sake, that's compared with about 55% of national suicides and 67% of Georgia total suicides. And I'm talking about population at large, not veteran population. So you can definitely see the difference. And just for the little pie chart, that's showing that among the veteran suicide deaths in 2021, the vast majority, almost 83%, were by firearms. There were some that were by suffocation, that includes hanging, and then all others combined were about 6%.
Right.
Go on. This slide right here is the moneymaker. I use this slide in every presentation that I've put together since I've been in suicide prevention with the Atlanta VA. This is the slide that shows why lethal means safety is so important, why time and space is so important during that short period of time when somebody is in a suicidal crisis and they can't think of anything but ending their lives. They get like tunnel vision and they can't think of anything else. So this is what it looks like. The graph on the left, those three pie charts, show that in almost a quarter of cases, the time between someone's decision to make a suicide attempt and the actual attempt is under 5 minutes. Under 5 minutes. So if the person has access to the lethal means during those 5 minutes and can't think about anything else, that's when suicide happens. The middle chart shows you that in almost half the cases, that time between the decision and the behavior to make a suicide attempt is under 20 minutes. And then in the third one, you see that in just over 70% of cases, that time between the decision and the suicide attempt is under an hour. So what I'm trying to say is there is a very intense and unpredictable but short period of time when lethal means safety makes a difference. And then on the right, this part on the right is about how often those suicide attempts are actually lethal. So in the first pyramid slide, you can see the blue part, by the way, is not lethal. The red parts is lethal. So when firearms are used in a suicide attempt, they are lethal in almost 90% of cases. That's compared with just a second. That's compared with the last of the pyramid charts over there. You see that the tip is the only red part of that. When all other methods are combined, they're fatal in about 5% of cases.
So unfortunately, I have lost 11 that I have served with to suicide. And since I've been medically separated from the Army, I have buried 17 to suicide. In one instance, unfortunately, we had a Marine. I will not mention his name out of respect for his family and his kids, but we got the phone call that he was in crisis. In less than 30 minutes. He walked into the bedroom and took his life. He is survived by his widow and 4 kids. We have to think about this. These aren't just statistics. These are families that are being impacted on a daily basis in the state of Georgia. Georgia leads in so many other ways. This is one way that we cannot lead anymore.
Amen. So let's talk some more about the data that have to do with veteran suicide rates. So this slide basically is looking at the data that were from the National Veteran Suicide paper that was done in 2023. And what it shows you is that in every single category, every ethnicity, race, age group, gender, the suicide rate among the veteran population went up in the time period between 2001 and 2021 in every single group except one, and that one group was men aged 75 and older. Every other group, they went up, and that's despite all that has been done, all that we've been trying to do to address this problem. Suicide is the top clinical priority at the VA. And yet this is happening. This is what the data is showing. So, yeah. So this is looking at veterans versus non-veteran adults over those 20 years. The bottom line, the lighter blue is non-veterans and the darker blue is veterans. And you can see that the suicide rate over those 20 years increased in both groups, but especially the rate was at a faster rate among the veteran population. And this is look at male versus female, both in the veteran population over those 20 years, showing the exact same thing. This is what I call the angry red line. So this is looking at suicide methods. And you can see that the methods of suicides that were used, lethal means that were used by veterans over those years increased in all but poisoning. But the angry red line is the firearm suicides. And you can see that increased, despite everything we've done, by almost 60% during those 20 years in the veteran population.
So what we're saying to you is, even as a veteran, we have to admit that we have way too many firearms that are readily accessible to people who are struggling. It's not PTSD. It is more than just PTSD. People are struggling, and we have to come combined collectively to do something more impactful, more consistent. We have to change our methodology. We all have to lean in this.
Well put.
Yes, sir.
Let's get ready to open it up for questions until Senator, the Godfather stepped in on me. Go ahead.
Do y'all keep a record of these folks? Whereas if they did an investigation for a pistol or a gun, being able to access a weapon. I mean, if you're a felon, you can't do it unless you get a restoration of rights back.
Mm-hmm.
Everybody talks about the mental part of it. If we are able to do something that will slow down the proliferation of guns,
Mm-hmm.
and we had the information where a probate judge can deny them buying a gun based on history.
Okay.
Is there any way for a follow-up, have the information where law enforcement knows about it?
Well,
that's a good
there's going to be a
question.
two-part answer, if you will, sir. First and foremost, when it comes to agencies communicating, whether it's the VA, whether it's State Department of Veteran Services, unfortunately, there's too much red tape right now. There's too much red tape for us to understand when a service member leaves service, we don't know where they're going. That's one of the main problems. And the reason that's a problem is because we don't know if they're going to a community where they have resources or communities where they don't have resources. We also have to dispel some of these misnomers, if you will. It's not combat that causes people to commit suicide. It is not a combat-related issue. So one of the things that we need to do is also ensure that we're educating people properly so they understand this is just one aspect of what's taking place in society, because you have to study veterans. That's a VA mandate. That's a federal mandate. But people are suffering in our society. We have lost our compassion. We have lost our ability to just communicate. And I highlight that. I'm not sure. There was a young lady who was crying here. We have to do better. If one of our fellow human beings is crying or going through something, as a medic, I'm taught that I have to provide some type of resources. Why were we so busy and joyous and happy that we couldn't see that somebody's suffering? We need to take more time out and be more compassionate. To be very honest with you, prior to me being on this committee, I have all the weapons in the world. I love them. Why? Because I was trained on them. Plain and simple, I was trained on them. But as I started losing men and women, and after I kept having to go to funerals, I don't want to tell the story of my brothers and sisters in arms anymore to their kids.
Let me see if there's any of the other legislators have any questions for you. Thank you. Or any of our other legislators that are with us?
Somebody
have
had
Yes,
other
sir.
questions?
Can you hear me now?
Yes.
Yes, this is Senator Harbin. Just a question of, as you're presenting numbers, is there a percentage that where these are owned firearms that they own themselves, or they were used weapons that were owned by someone else? That was my question from a standpoint of as we deal with this. Was it their own gun, or was it one that they got from someone else, or what happened there? Do you have any kind of statistical data on that?
I don't have data on that.
Okay.
We can't, our committee cannot get into that information, unfortunately, because of the red tape.
Okay. Well, and it's just, it would be interesting in that, meaning myself and others that own these weapons. The question is for the veterans, as far as that portion, what did they use their own weapons? Did they have something they
And
took
that's a
from
great
someone else or
question,
whatever?
sir. That's a
Okay.
great question.
Thank you. I
Fortunately, we
appreciate
just
it.
can't get that answer.
Thank you, Mr. Chairman. Thank you all for this compelling, and we do have like to invite you to hang around. We do have some other speakers, and there may be questions for you toward the end.
Okay.
And we
Thank you.
welcome an opportunity. We're here for whoever wants to lean in on this. We're here. Thank you all.
Thank you.
Thank you.
Our next speaker is the Georgia Clinicians for Gun Safety, Dr. Sophia and Dr. Keisha. Did I get that right? Chandri and Dr. Keisha Frazier. Dub.
So thank you so much, Senator Jones, for the opportunity to speak.
Absolutely.
I am Dr. Keisha Frazier Doe. There's the pronunciation, a pediatric emergency medicine physician. I'm representing the Georgia chapter of the American Academy of Pediatrics. I was the past chair of the Council on Injury and Violence Prevention, and also representing the concerns of many individuals here in Georgia. I've spent 15 years working in pediatric emergency departments, 3 years as a pediatrician in Virginia, and the last 12 years here in Georgia. During the first few years in Georgia, I observed a disturbing trend. I cared for more children injured or killed by firearms in just 1 year compared to the entire 3 years that I was in Virginia. In fact, my colleagues and I went from seeing 1 firearm injury every 2.5 weeks to 2 to 3 per week. Since 2020, the Georgia Department of Public Health has reported a 47% increase in firearm injuries among children 17 years and younger presenting to emergency departments statewide. The statistics regarding fatalities are equally alarming. Over the past decade, the pediatric firearm fatality rate nationwide has increased by 67%. But here in Georgia, in 2018, 78 children under 17 and under died from firearms. But by 2022, in just 5 years, the number had risen to 154, an increase of a whopping 97%. If this trend continues, we could see 303 children killed each year by 2027. For context, in 2014, there were only 41 deaths in this age group.
Wait a minute now. Can you go over that number again? I think I
sure can.
missed something.
I sure can. So, but here in Georgia in 2018, there were 78 children who died 17 and under from firearm injuries. 2022, that number had risen to 154. If that increase continues, so that was an increase of 97% from 2018 to 2022. So if we had a 97% increase again every single year until 2027, the total will be 303 children killed each year.
What do you attribute that to? I know.
So
No, we're
so the
talking
word I
about
often
safe
say is
storage here.
access. So
Okay.
I say access to guns.
Okay.
So that's what I
That's what I was
attribute
hoping
to.
you would say too.
So it's the access. It's not the guns themselves. It's the access the child has to the gun.
Do you have any age groups in terms of these kids that are being injured? Is there one age group that's impacted more than the others?
So two age groups that we notice specifically in unintentional injuries are the toddlers and the teenagers. And for probably similar reasons, impulsiveness, curiosity, similar concepts. So despite these grim statistics, there is hope. Public health campaigns can change this narrative. For instance, pediatric motor vehicle crash fatalities have decreased nationwide by 43% over the past 2 decades due to implementation of safety measures like car seats, seat belts, and improved vehicle designs. I dare say that many of us drove here today without our seat belts. I'm pretty sure most of us wore our seat belts here. This is because of public safety campaigns. I have 2 cases of that patients that I cared for that are examples that exemplify the urgency of addressing this problem. The first involved a teenage girl who was brought in by EMS after a neighbor heard a gunshot. Just an hour prior, she had been regaling her father with stories about school over the phone. No note was found, leaving us uncertain if this was an impulsive act of suicide or accidental, or rather unintentional, because accident implies not preventable, but this was entirely preventable. This tragedy left her parents grieving a loss that could have been prevented. Another case involving a teenager who accidentally shot himself in the leg I cared for, his mom and aunt expressed that it never occurred to them that storing their firearm in the nightstand could be dangerous. This young man now faces years of rehabilitation, struggling with the loss of function in his leg, which will affect his ability to participate in sports and walk without assistance at high school graduation. Both patients share 3 common factors. They are under 18, and firearms involved were stored insecurely and were accessible to individuals who cannot legally drive, marry, or purchase alcohol or vote in Georgia. Additionally, these patients are both from rural counties. Our state data demonstrates that there are higher rates of emergency department visits for firearm injuries in rural or less populated counties. The 5 counties with the highest rates of pediatric firearm-related ED visits are Wilkes, Ben Hill, Jefferson, Dougherty, and McDuffie. This pattern is echoed nationwide, where rural counties typically report higher firearm death rates than urban areas.
That seems counter to what I thought the data would reflect. Do you have an explanation as to why that's the case?
So remember, this is a rate. So you're thinking at total gross numbers.
No, not total, just percentage.
Oh, so I think part of it is there's lots of reasons. There's probably also the thought process of the prevalence of guns in these areas and then access to the guns in these areas. But there's a multifactorial thing. Part of it could also be education, many things.
But most people would think the prevalence of guns are more available in urban areas than in our rural and suburban
Maybe.
areas.
So 40 to 50 years ago, many people owned guns for hunting, and you tended to hunt in a more rural area compared to more urban area. So that's another way to think about it too. And so that trend would probably continue with the prevalence of guns.
Okay.
In the Southeast, nearly 40% of the firearm injuries we see are unintentional. To combat this, we have worked to distribute secure storage devices at community events. We have found that parents are generally receptive to these devices and are eager to learn how to store firearms securely. Many express gratitude and lament they had never thought about how easily accessible and dangerous their lack of secure gun storage was. Like every cause of firearm injury or death, unintentional firearm injuries are preventable. A recent report examining unintentional pediatric firearm fatalities over 2 decades identified toddlers and teenagers as the most affected populations. Over half of these injuries occurred in the victim's home or someone else's home that they knew, with many instances involving children playing with or showing the firearm to others. Most of the guns were stored loaded and unlocked, often found in nightstands or sleeping areas. Sound familiar? In conclusion, I have 4 recommendations to combat this problem. One, a statewide public safety campaign. We need a comprehensive public service campaign like those in Texas and Illinois that remind families to store their firearms securely. These states both have lower rates of pediatric unintentional firearm injuries and overall firearm fatalities. If just 20% of firearm owners who currently do not store their firearms securely began to do so, we could reduce firearm deaths in Georgia by 32%. Number two, collaboration with community organizations. We should partner with schools, faith-based organizations, and youth groups to provide educational campaigns alongside secure storage device distribution. Number three, tax credits for secure storage devices, implementing tax credits for gun owners to purchase secure storage devices like initiatives in Louisiana and Virginia will provide incentives for gun owners to store their firearms securely. And my last recommendation, child access prevention laws. Stronger child access prevention laws have been shown to significantly reduce firearm injuries. States with stringent laws that impose penalties for negligent storage have seen a 59% reduction in fatalities, while a third of pediatric firearm deaths occur in states with no such law. Unintentional firearm injuries are entirely preventable. Together, we can make a difference in safeguarding our children. Thank you.
Your presentation both of you was extremely impressive. I'm just saddened at the numbers and that we haven't acted in such a manner to take the suggestions from our pediatricians. Doctors, thank you all.
And Dr. Chartery has more to say, but I will say I am also saddened by the numbers, but I think that we have such evidence with other campaigns of things that we've done that we know what to do. We have so many tools and our resources. We just need to implement them.
I agree. Let me just kind of remind everyone, by the way, all of the data that you're seeing presented at these meetings is made available to the public. So thank you. And we'll make sure we incorporate your recommendations into our final report. Any member from the study committee has any comments, anything before we move on to Dr. Chandri?
Yes, sir. Senator Carbon here. Question, in the statistical data you have by age groups with the children especially, is there a data point on whether these children were at home alone, whether they had some type of supervision? We are in a society in which there are a great deal of single-family parents, many of those having to work, and children coming home from school and places of that nature without any supervision. So I was curious whether that statistical information was available. The second, do you have any involving drug and alcohol? One of the things we are seeing is drugs and alcohol, even among minors, is a major issue. And is that data or that question asked as we're looking at this age group, especially for our young people today?
So the first thing with the unintentional firearm injuries and fatalities, definitely in the toddlers, is very infrequently are they home alone. It's just more like the toddler was in one room, maybe the parent was in another room. It's specifically in the cases that I gave as an example, the parents and family were actually in their home at the time. It just was, they were not at their place where the child was. The other question that you had about drug and alcohol involvement, actually, interestingly enough, if you look at data with drugs and alcohol, those are one of the things that are reducing in children overall over the last few years. So that is less of something that we're seeing. There's a lot of other kind of concerns for why this is happening. Specifically with unintentional, though, there's a lot of impulsivity and curiosity. And as we all know, children's frontal lobes are not, or maybe we don't, but as I will remind everyone, the frontal lobe is not fully formed until someone is actually close to 26. And so therefore there is the thing about access. So we think about all the other things that we lock up and keep away from children. And that is really more so the problem, is that the parent who knows that they're supposed to lock up the chemicals underneath the kitchen sink, but they didn't realize they're supposed to also lock up their firearm.
But there's no statistical data on whether these children were, and I understand the toddler issue, but whether they were home alone. This is a 12-year-old, 14-year-old, whatever. There's no statistical data that's being asked from that standpoint. Am I correct?
So what we know is it was at their home.
Okay, that's the question I was in. Okay, thank you.
Any other members? Dr. Chandra, we'll yield the floor to you.
Thank you so much. Good afternoon. Thank you all for the opportunity to speak today. I'm Dr. Sophia Chaudhary, a pediatric emergency medicine physician and a firearm injury prevention researcher. I'm also here on behalf of the Georgia chapter of the American Academy of Pediatrics, like Dr. Frazier, and currently serve as a chair of their Committee on Violence and Injury Prevention. I myself am also a mother of 3 young children, a 5, 3, and a 2-year-old, and so I do understand that frontal lobe comment quite a bit as they are growing up now. Over the past 15 years, I have worked in emergency departments at leading pediatric trauma centers. In that time, the frequency with which my colleagues and I have cared for children with gunshot wounds has skyrocketed. We've gone from caring for this every few months to now multiple times a week. Firearms remain the leading cause of death for children in Georgia. More children die in our state from firearms than from car crashes, cancer, or heart disease. And I know that this has been said at other hearings as well. This is a public health crisis and one that we can solve working together. Georgia's children deserve to grow up in an environment free from gun violence. The statistics this year paint a grim reality. So far, over 330 children and teens have suffered firearm injuries and received care in one of Georgia's emergency departments. At this rate, we will likely surpass last year's totals. For every 1 child that dies by a firearm in the U.S., at least 5 survive their injuries. One of the survivors I have cared for is a 5-year-old girl with pink hair clips who was unintentionally shot in the stomach by her 3-year-old brother. Her brother found an unsecured firearm in a nightstand drawer and while playing, shot his sister. Although she survived, her injuries were severe. Her life altered by a feeding tube and a permanent opening in her abdomen. Since that first visit, she has returned to the emergency department multiple times due to complications, often requiring hospitalizations, impacting her family's life significantly, from school disruptions to unemployment to debilitating fear. Her story is like that of countless other Georgia children. Research shows in nearly 2,000 children that survived a gunshot wound, half developed a chronic medical condition. Bullets can damage any organ, they can sever spinal cords, causing paralysis and the need for lifelong care. They can go through the intestines, causing perpetual issues with feeding, growth, and digestion. Children and teens who are shot experience more chronic pain, mental health issues, and drug use compared to healthy children of the same age. Outside of the physical and mental health trauma, there are also financial burdens. Estimates from the CDC show that in 2022, for children and teens with non-fatal unintentional firearm injuries, there were more than 1,700 hospitalizations, which incurred approximately $400 million in impact across medical costs, work loss costs, and quality of life costs. All of these costs are 100% preventable with secure storage. Secure storage is also critical for reducing the escalating rates of youth firearm suicide. From 2012 to 2022, firearm suicide amongst 10 to 14-year-olds increased by 70%. These are elementary and middle school students. And among 15 to 24-year-olds, the rate increased by 50%. A majority of these children do not make it to the emergency department, but when they do, they often pass soon after due to the severity of their injuries. One case comes to mind where I cared for a teenager that after a heated argument with a friend, went into his mother's bedroom and shot himself in the head. His mother had stored the firearm unlocked and thinking that the safety was engaged, that it was stored safely. Most parents believe that their kids cannot access their guns. However, we know that 1 in 3 teens have reported they can access a loaded firearm in under 5 minutes. While the association between adolescent suicide and mental health is well established, multiple circumstances contribute to youth suicide risk. My colleagues and I have recently published a study where we found that 3 out of 5 youth that died by suicide from 2010 to 2021 did not have a previously known mental health condition. In fact, youth that died by firearms, the most common means, were far less likely to have a preceding mental health condition in comparison to other means. Suicide by firearm is 90% fatal, as we heard in the previous presentation. And most youth who think about suicide act upon it in less than an hour. It is impulsive. If they use a gun, they do not get a second chance. Secure storage is one way to give kids that second chance. And that second chance matters. It gives them time and space. The majority of youth who survive a suicide attempt do not go on to die from a later attempt. The risk is averted with barriers to access to lethal means. In order to address pediatric firearm injuries truly as a public health crisis, we must have a widespread public health approach for prevention. That includes quantifying the problem at hand, identifying the risk factors, and coming up with solutions. We have given you a picture of the problem and illustrated who is at risk for these injuries. To reiterate plausible solutions to bring about change, this is what's needed for Georgia's children. First, state-sponsored and statewide educational campaigns that both define secure storage and explain its importance with messaging within the school systems, in the media, and also across healthcare systems and at the point of firearm sales. Texas schools require parent education on safe storage at the beginning and at the end of the year. It's mandated by their state. Funding for sustainable lockbox giveaways within the community, including hospitals, clinics, and community centers. We know that similar to other entry mechanisms, safety counseling plus device provision together is going to be more likely to result in behavior change. And in this case, families locking up their guns. A multifaceted approach is needed to suicide prevention, including universal lethal means counseling and screening, and support for culturally sensitive and accessible mental health screening and treatment, not only within medical centers, but also schools, recreational centers, and faith-based centers. Additionally, some states are tapping into state dollars along with their federal suicide prevention dollars to provide lockbox giveaway programs. And lastly, child access prevention laws. As my colleague stated previously, states would secure laws that require responsible gun ownership where firearms are stored to securely to prevent unauthorized access, reduce all pediatric firearm injuries. And in this particular case, that also includes firearm suicides. Thank you, and we'll stay on now to answer any questions.
Thank you. And thank you for applauding. We need that, by the way, because that was an excellent presentation. Any member of the committee questions? See, you said it all. And those numbers are stark, they're dark, not the kind of numbers we want to see in Georgia. And the mission of the study committee is to address those things that you all just brought to our attention. And hopefully by your presence here today, you not just brought it to our attention, but all of Georgia as well. And I know Georgians would appreciate us doing something and acting on this behalf, particularly for those incidents, those unintentional shootings that can be prevented. And we are committed to that. Thank you, doctors, for your presentation.
Thank you. Thank you.
And while we're waiting for our next guest to come up, Ms. Aaliyah Strong found the time and Thrive Beyond Grief, because she has a panel that she'd like to bring with us. Let me just kind of go over some of the work that we've been doing with this body and just some of the research. How are you?
Good.
So now you're in the hot seat. I get to ask you questions.
It's okay.
Instead of you asking me questions. Just some of the data that we've gone over, and thank you to Austin over in Senate Research providing some of this data to us. I'm just gonna read some of it off to you quickly. There will be others. In terms of, you heard many of our speakers talk about child access prevention laws and penalties. Here are some of the states that have child access law penalties on the books. California. And these are the states that impose criminal liability when a child may or is likely to gain access to the firearm. California is one. Also applies to unloaded weapons, unloaded firearms, by the way. Washington, D.C. also applies to unloaded firearms. Minnesota, Nevada also applies to unloaded firearms. Vermont and Virginia. Here are states imposing criminal liability for allowing a child to gain access to the firearm, regardless of whether the child uses the firearm or causes injury. Delaware, Hawaii, Maryland, New Jersey, and Texas. That's just some of the data that we've been able to collect, and certainly we will share others as well as time progresses. Again, thank you to Senate Research. Our next guest, Ms. Aaliyah Strong, that I've had an opportunity to get to know. and tell us something about yourself and your organization, and I will yield the floor to you all.
Thank you. I appreciate it. First and foremost, just wanted to thank you for reaching out so quickly after the last hearing. It feels good to be heard. I brought an issue up in the last meeting, and for you to address it so quickly, I do appreciate that. And today I have a young man with me that is going to speak as well. As we know, Black men are 14 times more likely to be killed than their white counterparts. And Black men between the ages of 15 and 30 are 3 times more likely to be killed before the age of 35. And so wanted to have a representation of that in the room.
Firearms?
Correct, with firearms. And yeah, we'll just jump right into it. So for those who don't know, my name is Aaliyah Strong, founder and executive director of Time to Thrive Beyond Grief, which is a nonprofit that provides support services to families who have lost a loved one to gun violence. My fiance was shot and killed in front of me here in Atlanta in 2022, just a few blocks from where we sit today. And unfortunately, there are so many gaps in the system. And that's what brought me to this work. I wanted to be the voice of change for our community that tends to be underrepresented. I do have a 7-year-old son who has been impacted by gun violence at such a young age. And I see how trauma manifests in him, being a Black man, and the odds are already against him as well. And so when my fiance was killed, it impacted my life emotionally, financially, and navigating the legal system. And oftentimes what we fail to talk about is the impact gun violence has on survivors. And we need their voices to be at the center of these conversations and in these rooms. So what does this mean exactly? We have a lack of mental health resources here in the city, which needs to be addressed to also address the issue of gun violence in our communities. We have a lack of security in our school systems. We need to invest in more safety protocols, whether that's paying APD officers to be at these schools, metal detectors, just reinforcing safety for our students. And I feel like if we bring survivors, Black men, Black women, children, as you did today, to the table to hear their voices, we can stop the cycles of trauma and violence. And what's happening with survivors, and why I emphasize the need for their voices to be heard so much, is because many survivors, we know the root causes of violence are poverty, mental health diagnoses, and survivors are 3 times more likely to experience both. And they are also, and one of the leading causes of gun violence is retaliatory violence. And so we can address the root causes of gun violence, maybe we can get closer to the solutions. So 3 things that I suggest before I let this young man speak on his experience with gun violence and some solutions he may have in mind is we need to expand our investments in mental health services. We should strengthen our school security measures and strengthen gun control laws. I can't sit here and say that I have all the answers, which is why I rely on our elected officials, I rely on clinicians, I rely on community members, but I know that each demographic needs to be represented at these tables. And I don't have all the answers, which is what got me here. But I'm committed to fighting this fight with you all and for you all. I wish that more of your counterparts would have been here to be a part of this conversation. And I'm going to pass the mic over to you because I really want to highlight your experience as a Black man in this community and the demographic that's often underrepresented, but most closely to the issue. So.
And just one correction, by the way, we have 5 members that serve on this committee. All 5 of us are present today.
Yes, but some of them are on Zoom muted with their cameras off. So we don't know if they're even paying attention at this point now, do we?
Well, I know
Sure you do.
individual.
I'm here
I can-
and listening to what you're saying. and have
I'm
questions
I'm
if
saying,
you'd like.
I just feel like when we're talking about saving lives, it would be better to have people at the forefront and at the table that actually care about what we have to say.
Well, I think.
Appreciate you
Mr.
saying
Chairman,
that. We are
Mr.
listening.
Mr. Chairman, Mr. Chairman, if
I
I might.
understand, but you couldn't take the time to be here and look us in our faces. So I'll speak to your counterparts that are in front of me. Thank you for the concern, though.
But I would hope you would speak to all of us, because if we're gonna, and maybe just kind of remind everybody, uh, for us to accomplish.
Be reminded that we
anything-
need, that people want to save lives and
think I
that
have-
their voices need to
I-
be heard and
I
that
think I
they
have
should
the-
be here just as well as you had to wake up and get dressed and sit in front of us. They should have to as well.
Well, I think I have the.
And you don't have to save them. You don't have to
I
save
don't
them.
interrupt you.
It's
and I don't
okay.
want you interrupting me.
Okay, no
Otherwise, I
problem.
will ask you to leave.
No problem. I already said what I have to say either way.
One of the things.
And this is
I-
why survivor voices can't be heard, right? Because we get put out of rooms like this because our voices don't matter. And you have counterparts who would rather sit at home on mute and in their beds, twiddling their fingers instead of sitting in the seat that you are right now, right? So if you don't have any further questions, I would like him to have a chance to speak as well.
He will be given opportunity.
Thank you.
when I open the floor to
ahead.
him, but not until I ask him to speak because I have to finish my statement.
No problem.
Interrupted me.
I'm just letting you know.
One of the things that I'm.
And we
reminding
can't be silenced, by the
everybody
way.
here. See what happens when you give someone an opportunity.
What happens when you let survivors who are fed up
thought we
speak?
had-
That is what happens,
thought
because
we
we're
had a
tired. The same
conversation.
voices you heard was from the children yelling in the hallway. We're tired. And we don't
Mr.
want
Chairman.
political responses that just sound
Mr.
good.
Chairman,
Well, we're not going to have,
Mr. Chairman,
go ahead, go ahead.
if I
Senator.
might, I make a motion that we remove this lady from the committee meeting.
That's fine, but you're not even here.
Could I
Well-
ask this question? And
Hannah.
If you
Mr.
can come out, if you can turn your
Well-
camera on.
There is a motion on the floor, by the way, and anytime a motion is made, the chair has that. Is there, let me ask, is there a second?
I'll be right back. I'll be right back.
Well, thank you. There is no second, so the motion died.
No
One of the
problem.
things that I wanted to say is, if we're gonna pass any kind of sensible gun legislation in this state, one of the things that's important to me is that Republicans and the Democrats have to work together. This is not an R or D issue. This is not whether or not you're present or not present. This is everybody making a commitment. And I can tell you, the senators that are here with us virtually, I've known for the last 20 years, some of them that I've served in this body. And they're the ones that I asked the Lieutenant Governor to serve with me on this committee because I know their heart. I know their commitment to the study committee. And I also know that they are passionate about reducing gun violence in our great state, like we all should be. And I would hope that we, despite our emotions, that we certainly keep that in mind as we communicate effectively with each other. And that's one of the lessons that I hoped our young people got from being here this morning. And we have to set the example as adults. So I'm going to ask that please at all times that decorum be maintained and that we not cast dispersion on others that may be here physically or here virtually.
No dispersion, just
Because-
accountability.
Because again, for our committee, they're all counted as being here the same. Those are my feelings. Young man, go ahead.
Thank
Okay.
you.
Give us your name.
Good afternoon. My name is Jordan Butler. I'm an 18-year-old. I just graduated from Carver Early College in May. And I don't know how to do it, how they just did it and be real political and technical with it, but
You don't have
I'ma
to be.
tell y'all
Just-
real.
Just say it in your own words.
All right. So one thing that we have to work on with these problems of gun violence is productivity. If we have more opportunities and chances to do something better and greater with our life, then it'll be a whole lot easier to kill these problems. A lot of these problems happen because of maybe like with me being an eyewitness, I could say it's been struggling in family homes. So we get out there and we do crazy things and we try to go make, like young people, we go try to make some money. And the only way we know how to do is attack people who may have it and try to find the ones that are vulnerable who have it that may not be able to defend themselves. But maybe if we were taught in school and out of school around all peers, that is easier ways to be productive and make your money. You feel me? Everything isn't going to be easy, but we can at least get it to the point where it's legal and you're out of trouble. So I feel like productivity is a main part of it. The other part that I feel like will help gun violence is mentorship. We don't really have much of that anymore. Well, I'm not gonna say anymore, but where I'm from and the people that I have been around and the experiences that I have been able to experience versus my friends and family members, they haven't been able to experience the same things that I have. Quick background. I moved to Atlanta in October 2019. My brother passed away, and I became a victim of, no, I'm not gonna say a victim, but my mother went through drug issues and it affected me. I could have done the same exact thing that every other young person, I'm not gonna say every other young person, but the young people who are conflicting this violence, I could have been doing exactly what they're doing. But thankful for the people that were around me, they kept me straight. You know, they gave me ways to be productive. I was taking out trash or finding something to do. Playing football, I was being productive in some type of way. So we had to enforce mentorship and productiveness. I feel are the most important things we could do for young people in general. Getting them to the point where they know that it's okay to go through what you're going through and find an easier way out, a more legit way out. We got to be more legit. And it only comes from you all, the older people. We don't know. I mean, even though we are the future, we don't know much. You can look stuff up on Google and stuff like that, but that's not going to help the experience of the wise, the people who have lived what we are about to live, to get us through what we are about to see, you know, like the struggles and stuff like that. A lot of young people don't know what struggle they're finna attack, but y'all know because y'all have went through it. You get what I'm saying? So I feel like just sharing the experience with young people, mentoring young people, and finding more productive things would absolutely be the greatest thing we could do.
How prevalent are guns in your circle of influence, and those that you associate with?
Plenty. I'm talking about so many, like every other friend of mine has one. And I could completely understand that, but I'm away from it because I find ways to keep myself productive. It was at one point where when I was young, I wanted a firearm so bad because ain't no telling what may happen. And it's not saying that I'm going to be the one doing the attacking because I personally don't have the guts or cold heart to take someone's life regardless of what happened. Of anger, sadness. I mean, it is absolutely no reason except for self-defense. Unless you're finna be harmed, there's no reason that I feel like anybody should be able to pull out a gun and harm somebody. But everybody isn't the same. And they can't control themselves.
Tell me, what are some of the ways that, you know, some of your buddies can gain access to weapons?
Older people in general. It don't matter who it is. They can find somebody old enough who is willing to do it for the right price. They can get it. It's that simple. It's not hard. They don't go get fake IDs or none of that. It's literally right in y'all face. Somebody you know has possibly bought a firearm for somebody who is dangerous and not mentally ready to carry.
Wow, that's powerful. Thank you. Any member of the committee have any?
Yes, this
Yes.
is Senator Harbin. Thank you for the comments that are made. I say for this young man, I have a very close friend. He's black. I've known him for years, and he spent 6 months at Grady after being shot by a friend of his son. In that respect, and the issue is there. I was interested in this. And after I get through of the percentage of black on black, white on white. Just curious there. I totally agree with this young man on the issue of mentorship. In fact, there's a movie that's just come out called The Forge that is exactly what we're talking about. Whereas we see so many families destroyed or separated, there's no one there to mentor or to set examples. And the movie The Forge is about a young black man that is mentored by another man. Absolutely exactly what we're seeing. But our families are being destroyed, and are many times there is no family. but his comments are absolutely on target. We need to find ways to do that. But I was curious of the black on black, white on white. Is this issue racially driven at all? Or is this more, what are the percentages there? I was just curious. And I thank you for your comments as far as that. If you will, I'm sorry I could not be there this morning, but I really appreciate you being truthful and coming forth to let us know the environment that's there, and you're being right on target. I do say this, if you can watch The Forge, I'll find whatever funds are necessary for you to go to the movies or even buy it for you, because we've got to find ways to help young men become men and to take a stand in their community. And when we see fatherlessness, I believe is one of the greatest enemies right now we are fighting. We need men that will help young men become the men they need to be. But thank you so much. And if you know the percentage, I was just curious if this is percentage wise, what's going on there. But thank you. Please leave your name with us so that I'd like to maybe contact you again from that standpoint. I think your testimony is very vital for our community.
Okay. And I want to say I appreciate you and you're welcome.
And please read your name into the record. Tell us who you
Okay.
are, and if you have a contact number, because we captioned everything that's been said today.
Okay. So my name is Jordan Butler, JORRYNBUTLER. My personal phone number is 678-974-6510. And since I'm still a youngin' and sometimes I might not pick up, I would like for y'all to put her number as well.
They got it.
Okay.
They got it.
Okay, so yeah, that's all the contact information.
Thank you.
I would like to say, sir.
Thank you. I appreciate that. I will make sure at minimum there's that. We'll talk by phone. I'll call you a little later on from that standpoint. And like I said, I appreciate you standing for where you are, and you're exactly on target. And with what we've got to do, we've got to change our family environments, and men have got to step into play in protecting their families, and that protection is teaching them how to be responsible young men. But thank you. Thank you.
Yes, sir, absolutely. And a few more things that I would like to say is so when you was talking about the black on black and white on white, me personally, my experience in Atlanta, I haven't seen anything being racially motivated. Is mostly because of either just plain on hate on each other for no reason, being in a certain area. You feel me? I'm not really seeing no more you're this color, I'm that color, you're living this lifestyle. It's just like you have more than me, and I've been growing up and fortunate for so long, and I want what you want, so I'm gonna try to get it. And a lot of times that happens and it fails. Other times you will see people just not liking each other because of things that are said, people that are talked about, and just them being pretty much I can't really say the words I want to say, but pretty much being sensitive, being real sensitive and letting anything get to them. And another thing I would like to say is for the parents that will be reading, or parents that are in here, I want y'all to understand that these young black men are and will be the ones taking care of your daughters and your sisters and your nieces and nephews. I mean, your nieces and cousins and stuff like that. So I feel like we have to not only think about ourselves and think about what they're doing, but we have to think about the generations that are about to come. We got to be understanding that if we're going to have any type of good chance of having great grandchildren or grandchildren, period, that we have to have these young men suitable enough to be able to take care of their loved ones and their wives and stuff like that. And the last thing I would like to say is the way to changing is not going to be all laws. We got to put some love into this as well.
Thank you.
A whole lot more love and less law.
Thank you. Just don't run for office and take my place anytime. Thank you, Mr.
I don't know.
Butler.
He
Thank
may be
you
a
all.
good replacement when you decide to retire, Chairman.
Few more statistics while we're calling up our next guest, by the way. And our next guest is going to be Jesse Ojeda and Augustine Cabrera, the Giffords for Gun Violence. And just to give you some more data while they're gathering themselves, by the way, here are some states that are imposing criminal liability only if the child uses or carries the firearms. And these states are Florida, Illinois, Iowa, Maine, Michigan, New Hampshire, New Mexico, North Carolina, Rhode Island, Washington, and Wisconsin. Even when a minor has gained access to a firearm, most states will exempt a person from liability under certain circumstances. And there's a list of states that would do that, by the way. In regards to civil liability, because you all have heard me speak often about criminal and civil liability, the data on that reflects that it varies in part by state. Some states, such as California, have specific statutes addressing firearms storage negligence. And there is some information about that one as well. And some states do not. So this is just some of the data that we've been collecting. And let me just kind of remind everyone that three of the things that we have focused on, three of the things I focused on is the first one would be, and I'm glad to hear our state school superintendent talk about alert protocol. There's an article in AJC where Superintendent Woods said we need more of a protocol, more of a process and procedures in our schools. And this is our state school superintendent, Superintendent Woods. I would encourage you to go and research that article and read what he said. And he talked about alerts from the position of, having a magic button you could press in the school to alert police and healthcare workers that a child is in danger of being episodic. When I think about alert protocol, I also think about out of the 180 school systems that we have in Georgia, having all of those schools understand and do the exact same thing in terms of when a child is in distress, when there may be an incident, when one child moves from one school system to another, because we know in this incident in Barrow County, this child moved from one school system over to another. And it doesn't appear as if all of that history in one school system followed him to another one. So when I think about alert protocol, I think about something much more expansive than just having a magic button you can press to alert someone in the school system that perhaps there's an incident that's occurring. So that's the first thing. The second thing is dealing with mental health issues. And we wanted to get the pediatricians here so we could hear data from them about mental health and as well as some of our other guests, by the way, about kids that are experiencing mental health. But I think we've ever heard some of our physicians testify that, there's a lot of unintentional shootings. And that's important as well. And we have to have processes and procedures in place. And not just the intentional shootings, but those that happen unintentionally as well. And I think encapsulating all of that is what we all have shared and mentioned. And I think the speakers and most of them have talked about CAP, which is child access prevention. And I think that's the critical element to the work that we do, the work that we would like to do. And hopefully, as we continue to deliberate in our study committee, we can come to some kind of conclusion, if you will, on what's best for Georgia. And thanks again to Senate Research, because I have all the data from the other states in terms of what their laws are like. And certainly my goal by the end of this final meeting we have on the 10th is to have something concrete in terms of legislation that our committee members can think about and study in, so that when we go back into session the second Monday of January, providing all of us get reelected, then we would be able to move forward with something that the Speaker of the House, John Burns, has already talked about, something that our Lieutenant Governor, Burt Jones, who created the study committee, I know is passionate about, and that we can get all of Georgians to support. So that's the goal of our committee, and that's how we're trying to narrow down this funnel. But that is my comments. Again, let's go on to our next presenter. And the floor is yours.
Thank you so much. Good afternoon, Senators. Thank you for having me here today. My name is Jessie Ojeda, and I am a state and local policy attorney with Giffords, which is a national organization dedicated to ending gun violence. I'm here today to talk about a crucial recommendation, and one which has actually already been raised by some of the earlier panelists from the Georgia Clinicians for Gun Safety, and that is a safe storage public education campaign. We believe this kind of effort can make a real difference in reducing gun-related accidents, thefts, and unauthorized access, especially by children and those with suicidal thoughts. As we've already heard today, unfortunately, every year we hear countless stories about children and those with suicidal thoughts accessing unsecured firearms, often leading to fatal or life-changing consequences. We also know that theft of unsecured firearms contributes to the rise in gun violence across our communities. Safe storage is a simple and effective way to prevent these incidents, yet many gun owners are unaware of the risks associated with unsecured firearms. Now, several states, including Tennessee, Texas, and Utah, have already implemented similar public education campaigns to promote safe storage. For example, Tennessee recently launched a statewide ad campaign on radio, TV, and social media, emphasizing the importance of securing firearms. Texas's Keep 'em Safe Texas campaign offers another model that includes a robust website offering educational materials such as flyers and pamphlets and toolkits in both English and Spanish that can be utilized by individuals, educators, and anyone interested in promoting best safe storage practices. Utah has also previously conducted a firearm safe storage campaign with a focus on reducing suicides and accidental youth deaths and injuries through responsible storage. Campaigns in these states have typically been appropriated for between $500K and $1 million, often on an annual renewable basis. So for less than 0.003% of Georgia's fiscal year 2024 budget, we could adopt this type of program. For reference, according to recent data, gun violence currently costs the state of Georgia around $23.9 billion every year, of which nearly $600 million is paid by taxpayers. Now, here in Georgia, we propose launching a similar public education campaign for safe storage. Our goal would be to align with successful state and national models, like the ones I've mentioned, as well as Everytown's Be Smart campaign, while tailoring our message to address local risks specific to Georgia and your communities, including things like firearms from vehicles, which have become an increasing threat in recent years. We would suggest that such a campaign use multiple platforms, radio, television, social media, and in-person events to reach a wide audience. Additionally, we would advise distribution of physical materials such as brochures and flyers in both English and Spanish, making sure that these resources are available to parents, gun owners, and educators. These can be distributed in collaboration with schools, local law enforcement, and healthcare providers who can maximize outreach and ensure the message of safe storage reaches those who need it most. Safe storage is not just a recommendation, it is a necessity to protect our families and communities from preventable tragedies. We believe that a public education campaign on firearm safe storage here in Georgia could save lives. We have provided the committee with a memo covering this issue in more detail and are happy to address any questions regarding this proposal. I also wanted to briefly address Senator Lucas's earlier comments regarding firearm permitting and waiting periods, and let the committee know that Giffords is available to work with any of the committee members on this issue, as well as on cap laws, which you also mentioned, Senator. And we believe these policies are equally critical in addressing the epidemic of gun violence. So thank you for your time and consideration.
I'm not gonna let you off that easy. How many states have these public education campaigns?
So I briefly highlighted Texas, Utah, and Tennessee, but I believe that there are a handful of other states that are currently contemplating similar public education campaigns. I don't have the exact number off the top of my head, but I'm happy to get you that data.
Do they have a campaign in states that do not have child access prevention laws? Or is it something that works concurrent with?
Yes. So again, I have to double check which states have the child access prevention laws and which states are running these public education campaigns, but I would believe that they are run as distinct programs.
And I know you got our colleagues' attention when you mentioned the cost of Georgia, by the way. Can you go over there and just kind of break that down? Because I heard the number, was it $23 billion or something?
Yeah, so this is the number that comes from our colleagues at Everytown. So they will actually be able to provide more of the specific data there, and I can put you in contact with them. But that number again was $23.9 billion, of which 600 million is paid by taxpayers, and that is the cost of gun violence in Georgia alone.
I'm assuming that cost would include incarceration, pediatric care.
Yes, it is a wide-ranging cost. Gun violence impacts us on so many different aspects of our lives, as we've heard today, from schools, healthcare, incarceration, as you mentioned, that it is truly an epidemic.
Thank you. Does any of my members questions? Well, I guess they're letting you off easy.
Great. Well,
What
I
would-
will follow up with my colleagues to get you
Given-
more of that data.
What would you recommend for this study committee? I hate to use the term kind of low hanging fruit, but something that we could do right now in our great state that would help curb some of this gun violence. What do you think we should target first?
Yeah, I mean, education is a really critical step, but it's also something that's very easy to address. So you have a lot of these great models already that can serve as a basis for developing materials that can be immediately distributed to schools, healthcare providers, law enforcement. Very simple things like a brochure, a flyer that can be posted in school offices and hallways, things like that. As you've heard earlier today, a lot of times parents simply aren't aware of the risks associated with unsecured firearms, and the more you know, the better you can do.
But how do states do that are distributing this material? Do they have an entity, an organization, an outside NGO,
It's
for an
typically
example?
actually run through departments of public health or security. So that is the way it was done in Texas and Tennessee. It was run through their Department of Public Health. And they received appropriated money and had a team put together to develop these materials. They will, on occasion, I believe Texas hired an outside ad person to help develop their website, which is incredibly comprehensive and has, dozens of materials aimed at different audiences, children, educators, parents, and in multiple languages. So it depends on how much money you're willing to invest in this.
Senate Research, can you get me some data on the Texas program, please? And any other states that may have a viable program that you can think of other than Texas?
Yeah, absolutely. I will get you more information on that. And a lot of these programs were launched in 2023, so we're still fairly new. They're still growing them out. Texas has been renewed through 2025. And we hope that they will continue to renew it, as this is something that, can live forever.
Any data on the impact of the,
I think because it's so new, it's not publicly available yet, but I can see what I can find out for you.
well, what I do know is Texas, out of intentional, unintentional gun deaths per 100,000, I think we're number 7th or 8th in the nation, where they're down toward the bottom, I think number 26 or 27. So clearly what Texas is doing is having an impact on gun violence in their state.
Absolutely.
And they are one of the states that we're trying to model something afterwards. So thank you.
Yeah.
Any other comments from any of our members? Godfather's looking at me like, I know I see this. We got an attorney now, we got a griller.
Have to.
Thank you. And for the excellent comments, by the way, because that is one of the things that we're considering as part of our package.
Yeah, and absolutely. Like I mentioned, I submitted a memo to the committee with more details, but if you do have any follow-up questions, happy to address them.
Do we have that memo, Megan, that she submitted?
Okay, I'll get your email address afterwards and submit it to you directly then. Absolutely.
Thank
Okay,
you.
Thank you so much.
And I forgot to ask, Giffords for Gun Violence, is that the, I'm assuming that's Gabby Gifford's organization? Okay. I just had to say that publicly, that's all. We are right on time to wrap it up, amazingly. And now I'm going to give this opportunity to go around to our members to see if there's any closing comments. Vaping System was the last presenter, and they've already presented their product. And I see the CEO is still present. But let me just go around to start here with my friend, Senator Lucas. Any closing comments?
I think we have to do something. We all see it on television. And the weapons that are being used are assault weapons. I think we have to address it the way that the purchase of an assault weapon, which gives us the name, the address, and whether they are eligible really to purchase those kind of guns. Those guns are made for mass destruction. They're used in war. And I have to look at it real hard because I'm an avid fisherman and hunter. And you know, about the thing that's happening now are the same guns that our state patrol, our police have for rapid fire. And now the weapons that are being used are almost as powerful as the ones that we use. From the state patrol to the sheriff to the police. So these weapons are designed for mass destruction. And we have to address it. Not saying that you take the guns away, but there's got to be some responsibility as to who has it, who's buying it. It was a very sad situation with what happened at this school. But an underage person knowing how to use it. And I think the law was right, that the parent was charged because he is the one that bought it for that particular individual. And it's just like general liability. When I do a show, I had to carry $2.5 million of general liability insurance to make the county whole harmless if somebody does something crazy. And to me, it seems as though on your homeowners insurance, if you have it, that there's some liability there as far as economics.
Mm-hmm.
And I really feel that we are finding out about this young person when this young person was already investigated and said he didn't do it. But the thing you know, he has an AR-15 and goes to school with it. So we got to think about how we address issues dealing with guns. I've been dealing with it since I was 11 years old. Hunting with my cousins, doing those kind of things. And back during those days, we got paid. The folks didn't want the squirrels to eat the pecan. Seriously. And there was a bounty on the squirrel. If he's up in the pecan tree, it was a bounty on him. And as a young person, I like the bounty because I collected plenty on shooting the squirrel. But that was then. And now what we are faced with is folks getting killed with guns of mass destruction. You know, Congress, for 10 years, you couldn't do it. And now you can, and all we have to do is look at what the results are by getting rid of that law.
Here, here. Thank you, Godfather. My friend, Senator Lucas. Did any of our other members have any closing remarks? The floor is open.
I would just say this, is that the young man that spoke about an issue that we can put laws in place, but without love, it's very hard to deal with. And I believe that the issue that we need to look at as well, yes, there are safeguards that are here, but the other is this: how do we build family? How do we build a conscience of a people? And we've removed, and I'll just say this, we've removed 10 Commandments out of the classrooms. We removed a lot of things. I mentioned in the last one a need for chaplains in our public schools. I believe the metal detector issue is something we need to look at. At least that starts the process. The funding already for the notification tags that were was one of the reasons that there was such a great response at this last shooting by our resource officers. But I think we've got some information here is that we're going to have to attack this in different ways, and the law alone will not fix the problem. Also, lastly, I think he may have dropped off, but I was going to mention it was Senator Watson's birthday, I think. But other than that, good meeting, good content, and I think we will move forward on that. I have something on I'd like to contact you personally on, just an idea of what we might do, and pushing this thing forward. But I think it was a very profitable meeting.
Thank you, Chairman Harmon. Thank you so very much. And to our other presenters who lent their time here today, and to all of you that's been here. This has been a substantive discussion. Again, our job is to take this big font starts up here and to come down with something that we can pass legislatively in both chambers of this body. So I thank all of you for your input, for your advocacy. Vaping Systems, our CEO that was here, he hope you'll stay around and give a few more demonstrations on how to use this device to store assault weapons. And I've looked at your website, and you have some really big stuff out there too. You can store up to lots and lots of guns, and even handguns as well. I would encourage everyone to kind of get his card and his name, and if there isn't any other comments from members of the committee, if I had a gavel, we are adjourned. Thank you.